Let's go into other types of stones, shall we? This is a uric acid. So think about as to where you get uric acid. Be careful not to get this confused with urea. One has nothing to do with the other. Uric acid is a breakdown of your purines, which only means it's a breakdown of DNA, which only means it comes from cells. Are we okay? Or you're producing too much uric acid. And so you should know about the purine salvage pathway from biochemistry, and the fact that maybe there's a deficiency of enzyme. You all have heard of Lesch-Nyhan syndrome, and that is a deficiency of HGPRTase, right? Hypoxanthine guanine phosphoribosyltransferase transferase deficiency, resulting in increased uric acid. That child, what does that child want to do? Complete self-mutilation. Crazy. Literally, this child, if you've seen a child like this, it's sad, right? They're biting on their gums. They're trying to really hurt themselves. They can't help it. Maybe if they're playing on a bike, they literally put their hands in the spokes of the wheel to break their hands. I mean, it's so crazy. Self-mutilation. Lesch-Nyhan. That's one cause. What else may cause this? Well, cancer. Right? Chemotherapy is a big deal. And with chemotherapy, you're breaking down lots and lots and lots of cancer cells. Cancer cells, of course, contain DNA. And so, therefore, releasing all this DNA into circulation, you may then be introducing what? Good. Uric acid. This, of course, referred to. Take a look at the notes here. We have tumor lysis syndrome. Are we clear? So that's important. And, of course, your patient that may also have gout, right? Gout. And that would be perhaps a patient, usually a male, maybe middle-aged, and during the holidays might be consuming quite a bit of meat and also consuming quite a bit of beer. And then all of a sudden what happens? Oh, my goodness, my toe hurts. My big toe hurts, right? Podagra. So that's all part of uric acid issues. All right, so here, as the name implies, uric acid, decreased pH. Here, things get a little different. This crystal that you're going to find is going to be rhomboid or rosette, and the crystal that's rather on X-ray will be radiolucent. On CT, minimally visible because it's lucent. The first stone now that we're seeing in which its characteristics are clear. On ultrasound, US stands for ultrasound, may also be visible. Now, the risk factors include, we talked about this, dehydration, I told you about during, let's say, holidays, not consuming as much proper hydration, maybe drinking too much alcohol, perhaps, and then may result in precipitation. What else? Climate, acidic pH, hyperuricemia, we talked about tumor lysis syndrome. What do you want to do here with the urine? You want to alkalinize it, or maybe not even produce the uric acid to begin with. Welcome to our drug called allopurinol. And of course, allopurinol inhibits that enzyme called xanthine oxidase. So, but it takes a little bit longer, doesn't it? You're never going to use allopurinol for acute gout. It would never work. It takes too long. So this would be more for your chronic gout. Good. Move on. Now we come into cysteine. With the cysteine stone, it's rather interesting. We talked about this back in nephrology a little bit, where we refer to different reabsorption issues. And I gave you the mnemonic COLA, if that worked for you, cysteine, ornithine, lysine, arginine. And I want you to focus upon cysteine. And during our conversation with cysteine, we talked about how we have a clear, and there was a little cartoon there, and it shows you 6 sides of a hexagonal crystal. A hexagonal crystal, clear. So with that said, we have now a cysteine, decreased pH in your urine. X-ray will be radiolucent and sometimes visible on CT. The big thing here is the fact that it's clear and hexagonal. You're not able to properly take in your cysteine. It's autosomal recessive disease, genetic. In the PCT, you're not able to properly take up. There are your amino acids, cysteine, ornithine, lysine, and arginine. And these may then form staghorn. So be careful with that term staghorn. All staghorn means is a huge stone. Actually, if you take a look at the picture here, that looks rather large, could actually be confused by a layman, or if you're not paying attention on gross examination, as being a staghorn. Meaning what? Oh, maybe magnesium ammonia phosphate. But it's impossible. If the urine was pH and it was decreased, has to be uric acid. And if you're thinking about cysteine, a decreased pH, here you go. And then if it's staghorn and dealing with magnesium ammonia phosphate, its pH would be increased. Management, sodium, nitroprusside test is positive, is what you're looking for here. All right, so you actually do a nitroprusside test, and that's positive here. A couple things that are quite important. for cystine stones.